Hello doctors, welcome to Global Academy of Medical Sciences GAME, and this is Dr. Sunabha, your OBS-GYN faculty. I did my MS from JITMA followed by DNB. So today we're going to discuss one of the small topics which are often ignored, and sometimes very small and simple question will come from this topic. So Pessary is in OBS-GYN. So Pessary in OBS-GYN is most commonly advised in management of pelvic organ prolapse, or uterovaginal prolapse in three scenarios. One, minor degree of prolapse. Number two, which is most important, those who are unfit for surgery, because this is a conservative management. So those who are unfit for surgery, Pessary is one of the best treatment for them. And those who are waiting for surgery with major degree prolapse, there is a large decubitus ulcer going on, so we cannot operate right now and let that ulcer heal. So in those cases we can use Pessary. So what are the types of Pessary? Here we are discussing the types of Pessary which are used for pelvic organ prolapse. So one is support Pessary. First type is support Pessary, other one is space filling Pessary, and third type we'll discuss sometimes later. So imagine this is the uterus, the cervix and vagina. So support Pessaries are spread across at the posterior fornix like this and stretches and supports the pelvic floor, right? Till we can undertake pelvic floor repair, this supports the pelvic floor. So example is ring Pessary, and a very special type of supported ring Pessary is Milex Pessary. And space filling Pessary on the other hand is not like that, but this fills the vestibule, the cavity, by its bulk effect and prevents the uterus from coming down. So here the example is a cube Pessary or a donut Pessary, right? And there is one more Pessary which is a combination of the two gives support as well as space filling effect. So this is one disc with a projecting end like this. This is known as the gel horn Pessary. So let us see the images. So this is our ring Pessary. Which is most commonly used. This is Milex. Both are support Pessaries. This is our cube Pessary. This is our donut Pessary. These two are space filling Pessary, and this one is our gel horn Pessary. Right? So there is specific size of each Pessaries. So let us understand how to estimate the size of the Pessary. So this is the uterus, this is the vagina. So we do a vaginal examination. And measure the distance from the hymenal level to the posterior fornix. So this distance from hymenal level to posterior fornix. The distance is measured in inches and ½ inch is deducted for the right size. Now the thing is, whenever we look for the right size, we should always take one size higher and one size smaller and try to put all three consecutively and see which one fits best, right? And how to know that? So first, once we put, how to check? First we ask the lady to do Valsalva. So if it comes out it is too loose, too small, and if it is pressing on her urinary tract, it is too tight. Number two is, once the Pessary is put, she has to walk around roughly about 30 minutes. After that she should void freely. So if the Pessary is too small, then while she is walking, the Pessary will fall out. Whereas if the Pessary is large, it will create pressure on the urethra, which is immediately above the anterior wall of the vagina, and urine free flow will not be observed. So these are the tests. So you can ask me whether how to understand what is the hymenal level, particularly in a para 3 life 3 who has undergone many multiple vaginal deliveries, and after that only she has presented with prolapse. So hymenal level is at the same level of the urethral orifice. in absence of a urethrocoel. So the level of the urethral orifice, undescended urethral orifice, is considered as the level of the hymen. So there is one more very special situation where we use pessary in gynecology, and that particular situation is stress urinary incontinence. So we know that stress urinary incontinence happen because of the hypermobility of the ureter, and even if you do surgical correction, the surgical correction is basically a mid-urethral sling surgery to suspend or to lift up the urethra from its fallen down position. So the same thing we can do, we can put a ring inside the vagina which is a knob on its upper end, which actually slightly pushes up the urethra, right? So this is that kind of pessary, special pessary used in SUI, which is a ring with incontinence knob. So this is a ring pessary with an incontinence knob, right? These are the SUI special pessaries. This is ring with support like our Milex with incontinence knob. This one is known as the incontinence dish, whereas this is the incontinence dish with support. So this is our ring pessary, this is our Milex pessary, and just for the image based question, just for the image based question sake, remember this one is known as the Shack pessary. This is different from donut, right? Donut has a volume. This is flat. This is a flat pessary, like this, flat. Donut has a volume about it. So do we use pessaries in obstetrics? Yes, there is one indication of pessary in obstetrics, that is in cervical insufficiency, which is previously known as cervical incompetence leading to premature births. So the standard treatment for cervical insufficiency is either progesterone therapy or cervical circlage surgery in the form of McDonald stitch or Shirodkar stitch. So as an alternative to McDonald stitch, we can use this particular pessary, which is known as a barrel pessary, which you can see like a barrel sits in the vagina and holds the cervix closed so that the cervix cannot give away. It's like this. So if this is the cervix, this pessary holds the cervix like this so that the cervix cannot dilate. Cervix cannot further dilate, expelling the products of conception. So this, instead of a stitch, this barrel shaped pessary holds the cervix closed. I hope this video was useful for you, and all the best for your future exams. Thank you.